All blood pressure medications can have side effects. But did you know that some blood pressure medications are much more commonly known for their side effects? These can range from mild and annoying to quite serious. In this video, let's talk about the different blood pressure classes and which ones are considered the safest. By safest, I mean those with the lowest side effect profile. This video only applies if you're taking blood pressure medication for hypertension alone, meaning you don't have other medical problems. You visited your primary care doctor, they diagnosed you with high blood pressure, and they started you on medication. So the question is, which class is the safest for a first prescription? Which ones lower blood pressure effectively without causing unnecessary side effects or complications? If you're prescribed a medication by a specialist, such as an endocrinologist or cardiologist, there may be special reasons why you're on a specific drug. So this advice won't apply to every single case. You should never stop your medication just because of what you hear in this video. Instead, use this as a reason to have an informed discussion with your doctor about why they chose your medication and whether a safer alternative might exist. Now, let's review the major classes of blood pressure medications. Central agonists, clonidine. These act in the brain. They lower blood pressure but have significant side effects. Clonidine should never be your first medication for hypertension. Alpha blockers, terazosin, doxazosin. These block alpha receptors. They have many side effects and should not be first-line therapy. Loop diuretics, furosemide, bumetanide. They reduce blood pressure by causing fluid loss. However, they can disturb electrolytes and are not first-line for new patients. Beta blockers, atenolol, metoprolol, nadolol. They lower blood pressure but may decrease testosterone and increase blood sugar. Unless prescribed by a specialist, they are usually not the best first option. Calcium channel blockers, amlodipine, diltiazem, verapamil. Effective but associated with side effects. Not usually first line for uncomplicated hypertension. Thiazide diuretics, hydrochlorothiazide, chlorthalidone. Commonly used, but they can raise blood sugar and affect electrolytes. Should not always be first line. ACE inhibitors, that's lisinopril, quinapril, benazepril. Generally safe, inexpensive, and effective. A solid choice for many patients. Angiotensin receptor blockers, that's Losartan, Valsartan, Candesartan. These are considered the safest class overall. They have the lowest rate of side effects compared to other drug categories. Thousands of people have reversed hypertension through lifestyle changes like low-carb diets and avoiding seed oils. But for some, medication is still necessary, and in those cases, ARBs or ACE inhibitors are often the best starting point. If you're concerned about testosterone, avoid beta blockers. If you're worried about blood sugar, avoid thiazides and beta blockers. And if you're on one of the older drugs like clonidine or alpha blockers, discuss safer alternatives with your doctor. Thanks for watching. See you again in next video.